Good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to today's webinar on the Great American Smokeout, presented in collaboration with Friends Health Connection. Today is the American Cancer Society's Great American Smokeout. This event is held every year on the third Thursday of November to encourage Americans to quit smoking. Smoking is the single most preventable cause of death and illness. Every 1 out of 5 deaths is attributable to smoking. Quit smoking at any age has significant health benefits. During today's webinar, we will learn strategies for kicking the tobacco habit, how to access free smoking cessation services, and eligibility for the lung cancer screening. We will begin today's webinar with about 20 minutes of a moderated discussion, and then we'll open it up to our audience for questions and answers. We are pleased to be joined by Keri Britske, a community educator for Robert Wood Johnson Barnabas Health's Institute for Prevention and Recovery's Nicotine and Tobacco Recovery Program, along with some of her colleagues, as well as Dr. Eshan Patel, a hematologist oncologist with Robert Wood Johnson Barnabas Health Medical Group and the Steeplechase Cancer Center at Robert Wood Johnson University Hospital, Somerset. So thank you all for joining us. So first, maybe we could just start off by having each of you tell a little bit about yourself. So we'll start ladies first. Keri, if you would like to kick us off.
Yes. Hi, thank you for having me. So my name is Keri Breitsky. I am the community educator for the Institute for Prevention and Recovery from RWJBarnabas Health, the Nicotine and Tobacco Recovery Program. I've been with RWJBH for almost 18 years now, but prior to this position here, I was the Director of Community Outreach. And in that role, I had been out in the community creating programs to combat any disease processes that they may need in their area. But along with that, I also provided about 4 to 5 years of smoking cessation. So, and then that's what led me to become the community educator this past March with the Nicotine and Tobacco Recovery Program.
Great. Well, thank you again, Keri, for joining us. Dr. Patel?
Hi, my name is Eshan Patel. I'm one of the medical oncologists practicing at Robert Wood Johnson Somerset Hospital at Steeplechase Cancer Center. I have been trained at Weill Cornell Hospital System in Brooklyn, New York, and my interest is in lung cancer and done extensive research on lung cancer, tumor markers, and precision medicine targeting with novel agents like targeted therapy or immunotherapy. So thank you for having me today.
Well, and thanks again for joining. So Dr. Patel, maybe can you start us off with, telling us about the effects of smoking on your body and the types of health problems that it can cause?
Sure. So I think smoking affects most of our major body organs. It damages the primarily lung, and patient develops a lot of lung injury from smoking. That includes COPD, that many of us know, fibrosis, that requires lung failure and requires supplemental oxygen when it becomes very severe. Besides lung injury, it also affects a lot on the cardiovascular health. It can cause patients to get premature heart attacks, stroke, and also it can cause a lot of damage to our arterial and circulatory system. And then most common also is the major risk factor for developing a lot of the cancer. Not only lung cancer, I think we need to be mindful that it can also cause a lot of other cancers such as head and neck cancer, bladder cancer, pancreatic cancer. So those are the top 3 organs that it can cause a lot of damage to. Besides that, it can also cause peptic ulcer disease. It can also cause weakened immune system, make you more susceptible to get infection. And also it can cause more problems with your bones, such as early bone loss and also tooth infection or tooth decaying prematurely.
Mm. So then, on the flip side, what are the benefits of quitting smoking over time?
So up to 1/2 of all people who smoke can be expected to die from tobacco-related illness. So smoking cessation is associated with mortality benefit. It reduces the mortality. Means it reduces your chance of death from tobacco-related illness. So, and this benefit has been seen at any age if you quit. So just to give you a perception, stopping smoking at younger age, especially before age 40, associated with huge decline in your premature death rate. But again, when they saw quitting smoking even after age 60 was still helpful for a lot of the patients to lower their risk for tobacco-related illness.
Great. Well, thank you for that explanation. So now, Carrie, tobacco addiction is both physical and mental, making quitting cold turkey very difficult. So what's the first step toward quitting?
So yeah, tobacco addiction is both physical and mental, making it very difficult to quit cold turkey. So some self-help, proactive group or individual counseling and telephone counseling, they've all been shown to be proven to significantly increase abstinence rates compared to stopping cold turkey. So the first step an individual can take is to pretty much know their readiness to quit. So they want to identify why they want to quit and when they want to quit. So having reasons of why, whether it's, your health, to save money, to do it, to, reach a goal that you can't because you can't breathe as well, or because it's causing other of those disease processes. So identifying the reason why you want to quit is one of the first steps. And then setting a quit date and having a plan will also increase your chance of quitting and staying quit. So another first step is you can talk to your provider or to your or enroll in one of the programs, such as the Nicotine Tobacco Recovery Program, which I'll talk about a little bit later. So those are some of the first steps that you can actually take to get into a program and work towards quitting.
Great. Thank you so much, Carrie. So now, Dr. Patel, how can medication help and what types of medication are available?
So there are many different medications available to help you quit smoking. The first most common therapies that we know are the nicotine replacement, and there are many different kind of nicotine replacement available out there through patches, the nicotine gums, lozenges, and the sprays. This help you, of course, take that craving off of nicotine. Along with that, you can combine with other medications such as varenicline and bupropion, which are very good effective therapies. I think it helps you not only decrease the craving, but also help you some behavior changes in terms of gives you that behavior therapy along with the medication that helps take the craving down. It also helps more like a behavior modification. It also helps with the, when you combine it with nicotine replacement, it works better actually. In my experience, I think when you combine nicotine replacement along with one of those two medication and behavior therapy, it works great. And we have multiple different options available for patients.
Okay, thank you so much. Now, we hear about e-cigarettes a lot. So, Carrie, can e-cigarettes help you quit smoking?
So there's been limited studies that shown that e-cigarettes may help people stop smoking. So actually, according to a Cochrane study, they may work better, but there's no support or behavioral support alone, and they may not be associated with other unwanted effects. So however, seeking cessation treatment from a tobacco treatment specialist is the best way to go to quitting smoking with either vaping or smoking. But so far, the research shows that there is limited evidence that e-cigarettes are effective for helping smokers quit. There are other proven safe and effective methods for quitting smoking. One way, again, is to start talking to your doctor or a quit line counselor to figure out the best strategies. So compared with regular cigarettes, e-cigarettes have been on the market for a short amount of time. So about 11 years, you figure we have about 30 to 40 years of cigarette studies out there. So we're still learning about e-cigarettes and vaping. Scientists are studying e-cigarettes to understand how using them affects people's health. They usually contain nicotine, even the ones that claim are nicotine free. They're still harmful to youth, young adults, and pregnant women. And they contain harmful substances such as heavy metals like lead flavoring, flavorings linked to lung disease and small particles that can be inhaled deep into the lungs and cancer-causing chemicals. So using it as an alternative to help, it's still being studied, but you know, we do work with people in our program that do choose to go that way, and you know, we can still provide them with the therapies.
So just to clarify, what's the difference between quitting cigarettes versus e-cigarettes?
So in comparison to cigarettes and e-cigarettes, they may have lower levels of toxicants, but it can't be said that they are safe. So even though they are lower, doesn't mean they are safe. So electronic cigarettes do not have the same exposure to smoke as the combustible or burning tobacco products like cigarettes and cigars. So there may be less of a risk of lung cancer. Like I mentioned, it took 30 to 40 years to get the data to have the link to cigarette smoke to lung cancer. So, but since there are chemicals in the vapor, we can't say that they are safe. So using one over the other, you know, I can't say that is safer because of the chemicals and the limited research that we have right now.
Okay, thank you, Keri. So I know many people say it's very difficult, you know, they feel withdrawal symptoms when they start quitting smoking. So Dr. Patel, how can somebody cope with those withdrawal symptoms?
So I think first you need to know what are the symptoms, right? We know a few of the symptoms. So increase in appetite, feeling down, your mood instability, having trouble sleeping, irritability, anxiety, difficulty concentrating, and restlessness are some of the symptoms you experience when you try to quit. And usually it's more intense in the first 3 days and continue to have those symptoms more intense in first 3 to 4 weeks, and it starts subsiding afterwards if you continue to quit smoking. How do you cope with it? I think it's very important to know what are the symptoms, and then medications and behavior therapies are definitely help so much to cope with it. When I say behavior therapy, you can divert your mind during whenever you have those intense symptoms. Take a walk outside, do something that you enjoy, whatever your hobbies are. So when you divert your mind, whenever you're feeling those symptoms, it helps you overcome those symptoms and helps you cope with it well.
Okay, thank you so very much. So I guess then what are some tips for helping people, I guess, stay quit as we use in the industry? So Keri, would you like to field that one?
Yeah, actually some of them coincide with what Dr. Patel said about coping. So some tips on getting through actually cravings and urges after you quit smoking is to do some deep breathing during the urge. So bringing it back into yourself and feeling yourself be centered and focusing on your breath will help. Prepare for your cravings with some healthy snacks. So, you know, maybe some carrots and celery. You know, they have the same shape and you're getting that enhanced melt habit, but you're using a healthy snack instead of a cigarette or a vape. Think about how much money you're saving. You can focus on the why you want to quit. So when that urge comes, you know, focus on, okay, this is why I wanted to quit and I'm not going to pick up that cigarette. Change your routine. So if you initially get up and have a cigarette with your first cup of coffee in the morning, you know, maybe change up where you have your coffee, have it in a smoke-free room, don't go outside. So change up your routine and know your triggers. You know, so that could be one of your triggers, or, you know, going to a certain place that you would go outside and smoke could be a trigger, or hanging out with certain people. Have a good support system. So if you are having a craving or urge or having a really hard time, make sure you have that one person that you can call, whether it be your counselor, whether it be your friend, family member. Knowing who your support system is and where and when and why you can call them is very crucial. And to remember that a slip up doesn't mean that you failed. You just want to keep up, pick up back on, and continue with your recovery.
Great pointers. Thanks so much.
Can
So
I
I want to
do that, Serena?
go ahead. Yeah, go right ahead, Dr. Patel.
Sorry, I think one thing that in my experience worked very well was encourage patients to count the days since quit and reward themselves at each milestone, like at 1 year, 2 years, whatever they set as a milestone. That positive reinforcement, I think, really helps.
Excellent. Another great pointer. So thank you both. So I actually want to go back to something you both kind of touched upon when you were talking about cravings and food options. So we know that weight gain is a big fear of people, maybe a barrier of why people don't want to quit smoking. So Dr. Patel, if you could maybe field this one, but how can people prevent weight gain after quitting smoking? And I think you both touched on it a little bit, but maybe if you could maybe expand upon that.
Yeah, just to expand, I think more as Carrie said, definitely have a healthy dietary lifestyle. Avoid sugary and high fat food intake, because the sugary and high fat food intake usually cause you feel more sluggish, and that makes you crave more nicotine or smoking. So eat healthy. I think you need to know what are the healthy snacks, and whenever you feel craving, just have those low sodium, low carb snacks. Also, do more physical activity, more physical intervention, work out a little bit more. And it doesn't have to be like an intense workout. It can be just taking stairs at work, or just have more physical activity than what you used to do. I think just to elaborate more, as Carrie said, I think celery, sunflower seeds, anything that is crunchy, whenever you feel those cravings, if you eat, I think it helps you to take that craving down, or the smoking craving away.
So, and I just want to ask a follow-up question to that, Dr. Patel. So you mentioned physical activity. Is there a specific type of exercise? I mean, you mentioned walking, but if somebody, should they start an exercise routine if they haven't been doing that before?
I think it's great to start exercise routine for many reasons. I think even 10 minutes of exercise a day has shown to release a lot of those endorphins and make you feel better, just overall sense of well-being. And also it helps you a lot with taking that stress away that you go through during the quitting time. And it helps you better cope with the smoking quitting. Also, yoga is great. It helps you divert your mind. It helps you feel more relaxed, less stressful. It helps you divert your mind and more focused. So I think certain of those things you can put it in your daily routine. Yoga, there are a lot of yoga techniques. You can just put it in your daily while you're driving, or on those your routine lifestyle. You can put a lot of the changes. Those are easily made changes you can incorporate.
And thank you so much. And you bring up a good point, talking about stress. I know that this process can be stressful. So Carrie, can maybe you share with the audience what are some types, tips for managing stress after quitting smoking?
Yeah, so a lot of reasons why people pick up smoking again is because they say that they can't, deal with a stressful situation. Well, we all there are stressful situations that are, not prevented, but they come out of nowhere where the person isn't prepared for it, rather than, they know they're about to go into a stressful situation, so they can plan for it. So, but when something happens, when something arises that's unplanned, sometimes that's when people go back to smoking. But tips to manage the stress, on either situation is to talk to yourself and be kind. When an urge comes, just say, slow down, you're doing great, and keep on going. You can keep on going. You can do this. Use positive I statements. I am not a smoker. Distract yourself. You can brush your teeth or a minty fresh breath. You can work on a new hobby. Analyze the urge and the stress. So why do you feel the urge, and what is the stressor? And then find another way to change your mood or take a break. Move your body. As Dr. Patel said, do some yoga, which can bring on some meditation. So that will help relax your mind and relax your body. Remember to breathe. So bringing it back to your breath. So anything that actually has to do with, calming yourself down, such as meditation, yoga, and bringing it back inside to your breath, I always say, will help you just relieve that stress.
Okay, thank you. Those were great tips. So then what are some healthy habits people can develop to reduce their urge to smoke? And I think you touched upon that a little bit too. Is there anything else you can add or suggest?
Yeah, some of them, coincide with each other. Like another healthy habit, again, is to start a new hobby, something that will take your mind off of, smoking. Do something that's going to make you happy. And then find new ways to socialize that don't involve or revolve around smoking. This could be open you up to meeting new people. Change your routine again. Spend time with family and friends. So remember, smoking takes time. So you're going to have all this free time since you're not smoking. So you want to spend it wisely, and why not spend it better? Better way to spend it is with your friends and family. So, when you're not smoking, fill up that time with some positive things in your life that's going to bring joy and happiness.
Great, thank you. Now, can you tell us about the smoking cessation services available at Robert Wood Johnson University Hospital, Somerset's Steeplechase Cancer Center? And Keri, would you take that one for us?
Yeah, so we are through the Nicotine and Tobacco Recovery Program. We are an 8-week evidence-based program. We have, part of the evidence-based treatment is that we use Fagerstrom and initial assessment, which is a scoring system, which rates how dependent a person is on a cigarette or nicotine. And then that tailors how the specialist will provide their counseling and provide the amount of NRTs that the patient would need. So it's 8 weeks. So we do that as the first one. The second one is we identify triggers, and that's when the NRTs are given to the patients. Then week 3 is quit date. So they do quit on week 3, and then we go, through what we talked about: stress management, weight management, and then relapse prevention, and then we celebrate their graduation. So we do have a certified tobacco treatment specialist for Somerset, and he is on here. He's Chris Novak. Give him a little shout out. So we do have someone there, and so our program is actually through all 7 counties, but we do have someone at Somerset Steeplechase Cancer Center. So an easy way to enroll is, I know they are live in Epic, but for the sake of this this program, people can enroll through our quit center or calling our quit line.
So Keri, what is that number? Do you have that number handy?
Yes. So the number is 833-795-QUIT. And then the email is quitcenter@rwjbh.org. The easiest way to enroll is for someone to go to our landing page. It's rwjbh.org/nicotine recovery. And I just saw that someone had put in the information into the chat box as well.
Great. Great. So when they call, I guess there'll be an intake process, and eventually that information then gets forwarded to Chris, and that's when the process begins.
Well, the information gets once we get the referral, someone will reach out to them within 24 to 48 hours, and then we assign them to the appropriate counselor. So it is a quick turnaround. So they're not waiting a week for, from the time that they registered online. So we do get back to them within 48 hours, and then they are assigned to the counselor.
Wonderful. Yeah, there's a lot of great services over at Steeplechase Cancer Center. So
Yeah.
I want to just kind of switch gears a little bit. We know that smokers are really at high risk for lung cancer, and lung cancer screenings are now available for individuals with a history of smoking. So Dr. Patel, who is a candidate for the lung cancer screen?
So candidates for lung cancer screening are candidates who are high risk individual, which are usually people who are between age of 50 to 80. And with a 20 pack year history of smoking, and they can be either a current smoker or a former smoker who quit within the last 15 years. Okay. And we have a great program here at Steeplechase for lung cancer screening also, where we put you in the system for lung cancer screening, and you get that annual reminder just like routine how we do mammograms and colonoscopy. This takes care of all the patients who are high risk, and they get into the system, get their scans on a timely manner, and we detect cancer at early stage, and with the hope that we can take it out and cure them early.
Great. So can you maybe expand upon like what's involved in a lung cancer screen?
So lung cancer screening is usually done with the CAT scan, which is a multi-detector CAT scan, which is a high resolution image compared to X-rays. And it's usually done with a low dose radiation. So people are not being exposed at very high dose radiation. This gives us very enhanced pictures of lung, and we can detect even if there is any small lesion earlier. And without giving you a lot of radiation exposure. So it's very safe procedure. It's just composed of one scan once a year, and it's basically a CAT scan.
Okay. So are lung cancer screenings covered by insurance? That's usually a common question, right?
Yes, it's covered by Medicare, and most of the insurances. And I will say, I think if you meet in that criteria that I described before, all the high-risk patient, I think mostly, to my knowledge, all the insurances covers it. And you should always call us if you feel like you're a high-risk patient. We can get you, and we can talk to your insurance company and get approvals and whatever it requires to get you that screening.
Well, fantastic. And thank you both. I know I've asked you a lot of questions, but I would like to open it up to our audience at this time. If you do have a question for either Keri or Dr. Patel, please put your questions in the Q&A section of our webinar this afternoon. So, and while we're waiting, I guess either one of you, what is the best advice you could give somebody who's thinking about quitting?
So I think I'll go first. Sorry, Keri. I think ladies should be first. Go ahead, Keri.
No, go ahead. You're good.
I think it's very important to know what are the damages of smoking. I think, as I described, it really damages not your just overall health, but your mental health, your financial health, your social health. So it's very important to quit. Set a date and meet. There has been known studies that when you do quit smoking with some form of group or therapy, which our institution of prevention is providing the great overall treatment plan, from medication to behavior therapy to group in a group setting. When you do it with a counselor, I think the success rate is much higher. And you should always, it's okay if you relapse, but you should always know that it takes several times. It might take several attempts, but you're attempting, and that's the biggest deal. And we are here to help.
Sounds good. Thank you so much. Keri, did you have anything you wanted to?
Yeah, I would like to add on to what you said, that, it could take several attempts, and, someone should remember that each attempt, is a new learning process. So you can learn from your previous attempts, and why you slipped up and everything. So, and, they shouldn't look at it as a setback or anything. They should look at it as a learning process, that they can do this, and to still stay positive about it. And yes, to have a plan and set a quit date. So it is important to stay positive and to know that they can do this. So to have, maybe someone around them, that's part of their support system, that may be urging them to smoke, to ensure that person that it is possible to quit smoking. It'll be hard, it'll be a lot of work, but it is possible to stop smoking. And each quit attempt is different from the last.
Great. Thank you, Keri. I think you stopped. My screen froze.
I think that was a question in the chat regarding.
Yeah, I see it. So for you, Dr. Patel, how much more detail is the lung scan as compared to the X-ray, like years of difference?
So I think the X-ray gives you that one view of the lung compared to CAT scan, which is more like a multi-dimensional view. So it's much better in terms of detecting even the small lesions that you might miss on the X-rays.
Okay, great. And years of difference?
Years of difference in terms of?
The question didn't, that's all they say, years of difference.
I don't know if this is more regarding the pack year history difference. So if somebody, whoever asked the question can, yes,
Elaborate.
I think Anna.
Well,
Okay, I've unmuted myself. Okay. What I meant, Dr. Patel, is if someone comes in for the lung scan and something is found, much more detailed, how long would it have taken that person to get to the point where on a chest X-ray, the same anomaly would be found as well?
Okay. All right. Thank you, Anna. Thank you for clarifying. I think it really depends on the size, right? So if you get your first scan and there is something like already 1 or 2 centimeter mass, I think you can find that on X-rays also. But I think the CAT scans are very important in terms of it catches that cancerous or like an early image of like a small lesions, which might be missed on X-ray. So even if we find like a small millimeter nodules that we watch every year to see if it's growing, and when it starts growing to 1 or 2 centimeter, you catch it right away. So I think it helps in a way that it catches the small lesions earlier.
great. Thank you. Thank you very much, Dr. Patel. Thank you, Keri. Not seeing any additional questions, then this will actually conclude today's webinar. Please remember the information provided by our medical experts is not a substitute for medical advice from your own physician. If you need a physician, please call 1-888-724-7123. For more information about smoking cessation services and the lung cancer screening at Robert Wood Johnson University Hospital, Somerset, please visit us at www.rwjbh.org/Somerset. On behalf of Robert Wood Johnson University, Somerset, we thank you all for joining us this afternoon and take care.
Thank you.
Bye,
Thank
everyone.
you.
Bye.